Welcome to the Human Momentum Podcast. I'm your host, Eric Schabert. I created this podcast to leverage 12 years of osteopathic medical training and over a decade of experience in primary care medicine to help sort through the confusing and sometimes contradictory health information found on the internet. I want to distill all this information down to a form that you can use every day to optimize your health as you move forward through life. So if you are looking to get to life's finish line with the ability to do the things you love intact, then this podcast is for you. If this is your first time here, please don't forget to smash the subscribe button and throw us a like as well. It really helps us get this information out to more people. With all that said, let's move on with today's episode. Hello and welcome to the latest edition of the Human Momentum Podcast. Today I want to dive into one of the things that really motivated me to begin this podcast, and that's a realization the quality of medical content on social media these days is really pretty spotty. There's a lot of stuff out there that is loaded with inaccurate information and misinterpretations that lead to developing a lot of opinions that are not well-founded based on our current scientific understanding. This has led to a real distrust of our medical institutions and medical experts that are present online. And it's also led to a lot of people becoming enamored with and following individuals who are posting information that is not at all accurate. I want to try and clear up a lot of misconceptions out there, and I want to get people as much as possible up to speed and up to a level where they can evaluate things themselves and come to correct conclusions about medical topics, whether they have an expert that they're trusting or not. So what I would like to do is use a case study I came across and an opinion article on it to try and illustrate the problem a little bit and hopefully help all of you out there get a little better level of understanding of why this particular article was interpreted the way it was on news sites and why that interpretation is probably quite off base. The article I'm talking about is a case study that was published in a peer-reviewed journal called the Journal of Personal Medicine, which is a journal that has a somewhat controversial and spotty history among medical professionals. They previously published a few studies where the conclusions really weren't supported by the data. And one of these is a study that was referenced by the White House. Without going back into that in too much detail, I want to go into this particular article. This is a case study originally published in June of 2024, and it's a 2-year case study of fraternal twins, 2 little girls that were originally diagnosed with autism spectrum disorder at 20 months of age. There is a review article that I came across on MedPage Today, one of the resources that I use to become aware of different issues with medical research and different research articles that have been published. This particular article was written by an individual named Katie Suleta. She is a doctor of health sciences and a master's of public health, and she has worked in medical research and epidemiology for some time. She is highly critical of this article and feels that its publication should be retracted for a number of reasons we'll get into. And she feels that the research doesn't add much to scientific body of evidence. I think she's being a little bit overcritical. However, she raises some very valid points. In this study, these 2 children were treated with a variety of approaches, including some of the traditional behavioral and speech therapy that is used in autism spectrum disorder commonly across the country right now. Additionally, they were given a fairly complex supplement regimen, a series of rather strict dietary interventions, and they were treated with some alternative therapies such as craniosacral therapy and osteopathic manipulative interventions. Over the course of 2 years, they saw their autism spectrum related symptoms as assessed by a clinical severity index called ATEC that is widely used, improve significantly. The original testing was done at Walter Reed Medical Center, a very prestigious military hospital. The follow-up evaluations were done at the center where the research was performed a separate medical center. The issues with the study are that, number one, 5 of the 6 primary authors are linked to an organization called Documenting Hope. This organization is, according to its website, dedicated to helping the parents of children with a multitude of difficult to treat and difficult to manage health issues, including autism spectrum disorder. The issue comes from the fact that Documenting Hope does receive funding from a number of supplement manufacturers, including ones that were used to supply the supplements in this case study. These conflicts of interest were not revealed in the publication of the study, and that is, of course, problematic. No matter how well-intentioned and no matter how pure the motives and approach of the researchers in this case study, the fact that they have these connections can certainly lead to an introduction of bias in the results, especially because ATAC does require a little bit of subjectivity in its interpretation. So there is always the possibility for the researchers to introduce bias in their final evaluation of the outcomes. Now, it should be noted that the parents of these 2 little girls were extremely happy with the progress they made through this case study. And there is commentary from them included in the publication in which they express a high degree of gratitude in seeing how much their children improved. It should be noted that one of the 2 twins had such a low score on the ATAC at the conclusion of the study that she would qualify as essentially having a normal level of function. And both of these twins qualified as having moderate autism spectrum disorder related impairment on the initial evaluations. If they had remained at that level of severity, both would have required quite a bit of assistance to continue to function through life. And they progressed to a point where, if these scores are accurate, one of them would require no assistance at all, and the other only minimal assistance in order to be able to get through things like education and to function in a job-related environment as adults. This is, of course, significant, and it is absolutely reason to perform further research to try and evaluate this type of approach in treating autism spectrum disorder. Now, it should be noted that the authors themselves, in their conclusions, say that that's exactly what the study means, and that it is not an indication that this treatment approach was completely causative of the outcome seen, and that it is applicable across the board to anyone with a child who has autism spectrum disorder. The Institutional Review Board, which is an organization that oversees any medical research done at an institution, actually acknowledges that this case study, because it is just a case study of 2, doesn't even qualify for IRB oversight, and that the research results here are not applicable as generalizable knowledge. What that means is that we can't take the results of the study and say, oh, because these 2 twins improved so much, if we take this approach with other individuals with autism spectrum disorder, we're going to see a similar result. We simply do not have that knowledge from this particular study. And yet, in both the Daily Mail and the Telegraph, 2 organizations that wrote articles based on this research, that's exactly what they claimed, that the method of interventions used here, that this combination of treatments caused the improvements we saw in the autism symptoms in these twins. And that is simply not true. So really, our largest problem here is the fact that these 2 mainstream organizations that were then picked up across social media misinterpreted these results and didn't realize that a case study of 2 doesn't mean anything as far as whether or not a particular approach to treatment is going to be successful in others. So for all of you out there, when you see something like this in your social media feeds, the first thing you should do is try and find out what kind of study they're actually referencing. And if they do say it's a case study and it's 1 person or 2 people or even a dozen, that this isn't something that is generalizable to the rest of us. And that at most, this is indication that we need further prospective studies, particularly if possible, a randomized control trial, to try and assess if these particular approaches are having the level of effect that we see in these case studies, or if it's just noise. because it might be. At the end of this video, I'm going to include links to the MedPage article by Dr. Saletta, as well as the published case study itself. And I'm also going to put these in the description of the video when I post it so that each of you can see the articles I'm referencing and what I'm talking about here. I hope this helps get people the kind of knowledge they need to look at at least these case study types of research and know how much faith you can put into this as far as, is this something that I need to pursue if I have a child with autism spectrum disorder or not? Or do I simply need to push my representatives to fund more research in this field using these types of approaches to see if this is something that is generalizable to my child? Anyways, I hope this helps all of you in your own quest for medical knowledge. And please do keep tuning into my channel. Please like, subscribe, and share if you find this helpful. And hopefully we can all get to a point where we are getting a better level of knowledge out there, and that we're getting our political representatives to push for more informed medical policy. Thanks again, and I'll see you next time.